A formal network of unions and healthcare bodies focused on addressing the persistent shortage of healthcare workers. This is the result of an agreement between the NTUC, 3 affiliated unions, and 8 healthcare industry associations. Now, the newly formed healthcare professional community will look into long-standing challenges faced in the sector. Its eventual goal, attracting more locals into healthcare and stemming attrition.
There is a need to tackle the persistent shortage of healthcare workers, which is made worse by the ongoing pandemic. Even before the pandemic, Singapore's rapidly aging population and increasing number of people with chronic diseases meant that many more healthcare workers were needed than ever before.
NTUC, together with the healthcare unions and associations, will engage healthcare professionals through this new platform in order to better understand the challenges that they face. Those in healthcare will have access to mentorship opportunities throughout their careers and networking opportunities across professions. The community also aims to increase understanding of different healthcare professions among the public.
Let's get more on this. We're joined by K. Thanalechmik, President of the Healthcare Services Employees Union. Tana, nice to have you with us. Now, as you heard from the introduction, the problems in the healthcare sector are long-standing. But what does this new alliance, this new network bring to this long-standing issue that was not being done in the sector before?
Yeah, this alliance or the grouping called the Healthcare Professional Community will actually allow us to collaborate and partner one another, understand each other's profession and try to do more for the community as well as for the professionals themselves in the area of career progression and mental wellness, work-life balance. And these are the areas of concerns to these professionals. And we aim to ensure that there's greater awareness of the various professions, for instance, optometrists, and for instance, physiotherapists and all the rest, oral health therapies. So what are these professions all about? And there must be greater awareness so that more people can join such professions as a result of it and have that kind of confidence and give them the due recognition that they actually earn. So with this alliance, that a lot more can be done. In fact, we want to embark on having a care week that is called the Care Awareness Ready Week to not only talk about the various professions, but the various alliances, but also to do good for the community in the areas of health, like for instance, eye health and oral health and mental health. So we hope to bring all these good things over to the community through these professionals. So across the profession, there's a lot of networking opportunities, understanding each other, cross-pollination of ideas, and trying to bring them to ensure that there's no manpower shortage, especially in attracting younger workforce into the profession as our Singapore population ages over the years.
The group has made it very clear that one of the key goals is attracting locals into the healthcare sector. What are some of the key challenges in recruiting such local healthcare professionals?
The key challenges is that, you see, during COVID, I think there has been a lot of challenges faced by the healthcare workers. For instance, long demanding hours of work and burnout. I think it is important that we rationalize all this, healthcare profession is a calling and it's driven by passion. Having said that, I think there must be a balance between, work and life at the same time to ensure their mental wellness and mental support is also being, equally looked at. It is pertinent for us to look at their career progression as well, because as more young people join the profession, it is important that we grow their profession, have more continuing education and training for them, in the areas of not only technical, skills, but also adaptive skill, core critical skills like communication, problem solving. After all, we are dealing with patients and delivery of patient care, as well as technology, because in the digital age, it is important that we also embrace technology to do good for patients.
Yeah, so
especially
I guess
in the area of telehealth.
Yes, and I guess in many ways this alliance is admitting that just attracting the talent is just one part, right? Because once you get them into the sector, they themselves have said there are pain points when it comes to their own progression and staying within that sector itself.
Yes, exactly. There's issue of recognition, there's issue of professional indemnity. Some of the associations are small and therefore the insurance professional indemnity is very high and very costly. This is where as labor movement, with our network, with our social enterprise, we can come together to help these professionals in the areas of their pain points, as I mentioned, the professional indemnity, as well as their career progression. In the case of LM Network itself, Healthcare Services Employees Union have partnered E2I and Learning Hub to form Healthcare Academy. And this is where the professionals can come in, lend weight to the programs and to the training programs that we want to roll out, so as to also upgrade our freelancers, self-employed professionals to come into the picture as Healthcare Academy rolls out these programs. And we can also attract, people who want to do a mid-career switch in these professions, and therefore giving them opportunity. And these are attracting local talents into the healthcare sector.
Well, we wish you luck in shining an even brighter spotlight on this sector. Thank you so much, K. Thanalachmi. She is the president of the Healthcare Services Employees Union.